Hello, my name is Niah, and I will be talking about hypothyroidism for my week 9 presentation. So hypothyroidism is when the thyroid, a butterfly-shaped gland located on top of the larynx, usually around here, does not produce enough thyroid hormone. Thyroid hormone can also be considered T3 or T4. But these hormones are very important for metabolism in the body, and metabolism is essentially how the body extracts and absorbs nutrients from the food we eat. So hypothyroidism can manifest usually as weight gain. That's usually one of the biggest markers, really rapid weight gain. One of the biggest markers of hypothyroidism, and it may even be coupled with loss of appetite. Some other clinical manifestations of hypothyroidism involve thinning or loss of hair, all types of hair throughout the body. It can manifest as pitting edema in the lower extremities, actually bradycardia, which is lowered or slow heart rate. It can also manifest as periorbital swelling, so swelling in this area of the face specifically. And also goiter can be present, which is when the thyroid starts to swell and it'll show up as a large mass on the neck. So being that the thyroid is a gland that produces hormones, one of that produces hormones is part of the endocrine system. So I'll be discussing three syndromes of the endocrine system, specifically hypopituitarism, hyperthyroidism, and Cushing syndrome. Hypopituitarism is when the pituitary gland in the brain doesn't produce enough of or any of the hormones that the pituitary gland is responsible for. That includes growth hormone, luteinizing hormone, TSH or thyroid stimulating hormone, prolactin, adrenocorticosteroid hormones, and some other hormones that are responsible for the growth and development and metabolism of the body. So where hypothyroidism, you would test for T3 and T4 levels and see if they are too low. Similarly, you would test for all the hormones that the pituitary gland is responsible for. So you would test for growth hormone, you would test for estrogen or serum testosterone levels depending on the gender of the patient. Depending on the gender of the patient, you would test for serum cortisol levels, and whatever other hormones, TSH levels, whatever other hormones are affected by the pituitary gland. They're not only going to affect the pituitary, hypothyroidism is only affected by the loss of functioning of the thyroid, whereas there's multiple complications included in hypopituitarism, which is the differentiation between the two syndromes. Also, hyperthyroidism is the exact opposite of hypothyroidism. Hyperthyroidism is when the thyroid produces too much T3 and T4, and essentially it will manifest as extreme weight loss despite an increase in appetite. There may also be manifestation of hair loss and possibly goiter, but most of the other symptoms are the opposite of hypothyroidism. Tachycardia is also another clinical manifestation of hyperthyroidism. Patient may have irritability and nervousness. They may have an intolerance to heat, as opposed to those who have hypothyroidism, who may have an intolerance to cold. But that weight loss is a very big marker of hyperthyroidism. Just as you would test for hypothyroidism by testing the T3 and T4 levels, you would do the same thing for the T3 and T4 levels in hyperthyroidism, but you're just looking for different manifestations. Hypothyroidism, as in the name, you would be looking for too little T3 or T4, and the exact opposite, you would be looking for too much T3 or T4 in clinical manifestations of hyperthyroidism. And finally, Cushing's syndrome, which is when the body produces too much glucocorticoids and the cells receive too much glucocorticoids, which does affect metabolism in a different way than thyroid hormones do. Essentially, it'll affect more glucose, insulin, and cortisol in the body, which will cause weight gain like in hypothyroidism, but weight gain in Cushing's syndrome will be pockets of fat in specific areas, usually on the back in between the shoulder blades, which will be called the buffalo's hump sometimes, or on the belly, kind of like I guess metabolic syndrome similarly, where there's a larger waist circumference. Also really another marker of Cushing's syndrome is that patients bruise easily. They have very thin skin, and they also don't heal properly or as quickly as someone without Cushing's syndrome. And essentially, when it comes to testing for Cushing's syndrome, one would test for the ATCH or the ACTH, adrenocorticotropic hormones, as opposed to T3 and T4 in hypothyroidism. So hypothyroidism can actually manifest with some serious diseases. What comes to mind, as I mentioned earlier, bradycardia is a sign or a clinical manifestation of hypothyroidism. So this can lead to cardiac failure, which is the decrease of cardiac muscle contractibility or cardiac functioning, and also possibly a loss of cardiac output. So the heart muscles will become weaker due to the lowered and slowed heart rate. Additionally, another disease is cardiac myopathy, which is as the heart becomes weaker due to the slowed rate, the muscles of the muscles of the heart can actually can actually increase in size and thicken, despite the fact that they're weaker, which can also be caused by hypothyroidism. So, two diseases separate of their own from the hypothyroidism. Another disease that might not have been considered is actually depression. Those with hypothyroidism in really serious cases can actually start to develop slowed mental responsiveness and slowed mental acuity. And actually, some cases, if you look at hypothyroidism, some of the signs and symptoms can actually yield signs of depression, specifically the fatigue related to hypothyroidism, as well as the loss of appetite. And with that said, that's my discussion on hypothyroidism. Thank you. Bye.